Why would palliative care be right for a patient and his or her family? Let's start with some basics. What does palliative care mean? The term palliative care comes from the root word palliate, which means to alleviate, relieve, or soothe. Palliative care involves medical specialists who focus on quality of life to alleviate, relieve, or soothe the issues that are affecting how a person feels physically, emotionally, spiritually, and socially. If a person has a serious health condition or diagnosis, then palliative care is right for him or her. Palliative care is for all persons who consider their illness or health condition a serious one, whatever the diagnosis. It is not reserved for those with only specific conditions, a certain stage of disease or prognosis, or those near the end of life. This is a common misunderstanding. Palliative care is meant to help people live as long as possible, as well as possible. Sometimes, palliative care is provided at the same time that patients are receiving medical treatments to help them live longer, like dialysis, chemotherapy, or medications. Other times, the focus is on maximizing the supportive care options that make people feel better. Importantly, choosing palliative care does not necessarily mean stopping anything. It means focusing on what makes sense for patients and their loved ones, especially as they encounter changes along their journey. Quality of life issues can be complex. We know that most patients have a medical team, including primary care clinicians and specialists who have likely been focused on some of these issues all along. But sometimes, these medical teams may feel adding an extra layer of support from palliative care experts would be of even more help. So, what does palliative care do? Well, palliative care can help with several aspects of serious illness care. Often, palliative care experts are asked to help when there are issues regarding how patients feel, such as pain, shortness of breath, tiredness, or low appetite. They also explore the issues that may lead to emotional or mental stress, and things that may make a person anxious or worried. Also, palliative care experts want to understand things that give a person hope and strength. Knowing these helps better understand the whole person and his or her motivations and priorities. Palliative care experts also assist with planning for the future to make sure wishes and preferences are respected whenever and wherever care is received. They also focus on planning and making decisions for the stressful twists and turns that often come along with the journey with a serious health condition. Further, palliative care experts can help with the difficulties faced by loved ones and caregivers to make sure they feel supported. Palliative care understands the important role these people play in making patients feel better. Most importantly, palliative care experts provide an extra layer of support to partner with other care providers and make sure all the bases are covered. Let's quickly summarize. Palliative care may be useful for any patient with a serious health condition, no matter what the condition or prognosis. Patients may benefit from a palliative care expert at any time, from the moment of diagnosis of a serious condition or any time after. Being seen by a palliative care expert does not mean things are going badly. Rather, it means that a patient's medical team wants him or her to get the best and most complete care possible.